Hello, I'm Maura Carley, founder and president of Healthcare Navigation, and today we want to talk about doctors who opt out of Medicare. When we talk about the subject, we're talking about original Medicare, and Medicare regulates it's a very regulated environment. The doctors who do not opt out. And so we're not talking about this issue affecting people who are enrolled in an Advantage plan. Let's just focus on the fact that there are three categories of doctors for those who remain in original Medicare. Doctors who accept assignment, that's the largest category. Doctors who don't accept assignment, sounds negative, but it isn't really. They still submit claims and get their services paid for by Medicare. But the doctors who opt out are outside of the Medicare program altogether, and they have to file paperwork, referred to as an affidavit, with the federal government. An affidavit can be in effect for 2 years, saying they are opting out of Medicare altogether. That creates an obligation for them to inform their patients, because a doctor who opts out isn't submitting claims to Medicare, isn't getting paid by Medicare. Their patients shouldn't submit claims to Medicare. This agreement that the physician should execute with the patient is called a private agreement, meaning the fees they've agreed upon, it's private. It's not a matter of interest to the government. Now, I don't remember this data being available until about 2012. I may be wrong, but I remember there was a bit of a splash about it because there was great concern that this would be a trend, and at the time it was estimated that 3% of doctors had opted out of original Medicare, and it was, the whole canary in the mine kind of publicity about it. And what's interesting is that of late, the Kaiser Foundation took the data that's available on the CMS website, and we'll give you that tool in our copy that accompanies the video in case you want to check this information out yourself. But anyway, the Kaiser Foundation people, took the information and displayed it by state. And it's interesting in that only one state, Alaska, shows as having 3% of doctors opting out of Medicare. Now, you have a number of Western states that have 2% of doctors opting out, and that's sort of consistent with Western independence. But you have states like New York and California. I put in a different category than the states like Idaho and Montana and so on. But Colorado and California also have 2% of doctors opting out. You've got a whole host of states with 1%, and then you've got a number of states who have doctors who opt out, but the percentage is so low that it's counted as 0. So, you know what? This is good news for the consumer. And it's not too surprising. I think there are a couple of different trends probably going on here. One is practices being acquired. And when practices are acquired by hospitals, all the physicians in the acquired practice tend to have a relationship with Medicare. And there's also a trend of younger doctors being very comfortable joining a larger group and taking a salary and having the advantages of sharing call and having vacation and not have the burden of building a practice and the financial responsibility for the practice. But let's go back to a minute. Obviously, this issue is going to affect you most if you're in one of the states with the higher percentages. And it's interesting. We'll talk to people in states where they haven't even heard of a doctor being able to opt out. And then we deal with a lot of clients in Manhattan who have many physicians who've opted out. And physicians who've opted out have done this to have a level of control over their fees, because Medicare's payment rates can be pretty paltry. There's no doubt about that. So the news in the context of doctors generally not being thrilled about what Medicare pays them is at least good, in that this isn't a problem that's gotten worse over the last decade. But just understand, you should never be surprised by going to a doctor who opts out. They are obligated to inform you. You have to sign an agreement over the fees. And there's a very high level of compliance with this. We've seen a couple of physicians not comply over the years, but that is very rare. Just a comment about Advantage plans, because I know people like these videos to be short. This doesn't really apply to you, but just know that if a doctor opts out of Original Medicare, the likelihood that they're going to be in network with an Advantage plan is very remote. Very, very, very remote, because these are people who don't want to deal with Medicare or insurance companies. So again, I think I should wrap it up. Know, especially if you're in Original Medicare, what these three categories are. And understand that the picture over the last 10 years has not gotten worse. In fact, I think it may have improved. Thank you for listening. Take good care, and we hope to see you soon. Take care. Bye-bye.